Hi, I'm Denise Willis. This video abstract will discuss the paper Heliox Prescribing Trends for Pediatric Critical Asthma by Liu and colleagues. This paper was published in the May 2022 issue of the journal. Heliox is used as an adjunct therapy for treatment of critical asthma to avoid mechanical ventilation. It is thought to improve airflow in narrowed airways and enhance deposition of aerosolized medication, but there is little evidence to support that it improves patient outcomes. The study objective was to describe Heliox prescribing rates. The hypothesis was that children treated with Heliox would have decreased intubation rates, and those who were intubated would have decreased time on mechanical ventilation. This was a multi-center retrospective cohort study that used data from the Virtual Pediatric Systems Registry. Children aged 3 to 17 years who were admitted to the pediatric ICU for critical asthma from 2013 to 2019 were included. Those who had underlying conditions were excluded, such as congenital heart disease, interstitial lung disease, cystic fibrosis, neuromuscular disease, and several others. The primary outcome was Heliox prescribing rates and trends, and a subgroup analysis assessed the rate and duration of mechanical ventilation. There were over 43,000 encounters from 97 centers. 2.5% of all subjects received Heliox for a mean duration of 21.4 hours. Children treated with Heliox were older, and there were significantly more Black children prescribed Heliox as compared to others. The prescribing rate of Heliox decreased from 4.1% in 2013 to 2.37% in 2019. Centers located in the Midwest and South prescribed Heliox for critical asthma more often than those in the West and Northeast. Children who received Heliox had increased rates of mechanical ventilation, but there were no significant differences in the number of days for ventilation. In the overall group, the use of Heliox was associated with a longer length of stay in PICU. The overall mortality rate was low, and deaths mainly occurred in subjects who were intubated prior to admission. Heliox for treatment of critical asthma remains unproven, and its use has declined over time. There were differences in prescribing patterns depending on regional location. There were increased rates of mechanical ventilation in those treated with Heliox compared to those who were not, but there were no differences in duration of mechanical ventilation. The study limitations included the use of retrospective data, and the registry data is dependent upon entry from participating sites, so there's potential for erroneous data and sampling errors. The registry data did not include the indication for Heliox or the concentration that was used. The accompanying editorial noted that adjunctive therapies for critical asthma are not standardized, and this results in a wide variation of practice. The authors of the editorial pointed out that one of the challenges of the study was accounting for severity of illness and other confounders in subjects. Overall, they felt the study contributes to the literature and should be used to support efforts to standardize management of adjunct therapies for critical asthma. In conclusion, use of Heliox to treat critical asthma was uncommon, and its use was not associated with improved outcomes. Thank you for tuning in. Be sure and follow Respiratory Care on any of our social media sites. If you have any questions, don't hesitate to contact me by email.